Scene script. Have you ever wondered what exactly is menopause and how does it affect women? Well, it's high time we delve into this fascinating topic. Menopause, in essence, is a natural phase in every woman's life when her menstrual periods cease, and she can no longer become pregnant. It's not a disease or a disorder, but a normal biological process that marks the end of a woman's reproductive years. Let's break it down a bit further. You see, a woman is born with a finite number of eggs in her ovaries. These eggs are released monthly during her reproductive years in a process we commonly refer to as menstruation. However, as she ages, the number of eggs diminishes, and so does the production of hormones like estrogen and progesterone that regulate menstruation. When these hormone levels drop significantly, menstruation stops, marking the onset of menopause. Now, this doesn't happen overnight. It's a gradual process that typically begins in a woman's mid-40s to early 50s and can last for several years. This period of transition is often referred to as perimenopause, and it's during this time that many women begin to experience changes in their bodies and emotions, changes that are indicative of the approaching menopause. Yet it's crucial to remember that menopause is not a medical condition, but a natural part of aging. It's a phase every woman will go through, albeit with different experiences and symptoms. Some women breeze through it with minimal discomfort, while others may experience more pronounced symptoms. But it's important to note these symptoms are not the woman herself. They are just her body adapting to a new phase of life. So why discuss menopause? Because understanding it helps us empathize with the experiences of women going through this phase of life. It allows us to support them better, to validate their experiences, and to dispel the myths and misconceptions that often surround this natural process. Understanding menopause helps us empathize with the experiences of women going through this phase of life. So when does menopause typically occur and how long does it last? Now that's a question that has puzzled many. The average age for a woman to reach menopause is around 51 years. However, it's important to remember that every woman is unique and so is her body. Hence, menopause can start much earlier or later. For some, it may begin in their 40s, while others might not experience it until their late 50s. Before we dive into the actual menopause, there's a phase called perimenopause. This is a transition period that leads up to menopause, marked by hormonal changes and irregular menstrual cycles. Perimenopause can last anywhere from a few months to several years, with the average duration being around 4 years. During this phase, the ovaries gradually produce less estrogen, which is one of the primary female hormones. This decrease in estrogen levels is what sets the stage for menopause. The menstrual cycles may become irregular, and other symptoms such as hot flashes or sleep disturbances may start to appear. Now let's talk about the actual menopause. Menopause is defined as the point when a woman has not had a menstrual period for 12 consecutive months. It's the end of the reproductive years that began in adolescence. After menopause, you enter the postmenopausal phase, which lasts for the rest of your life. During this phase, many of the bothersome symptoms of menopause ease for most women. However, due to lower levels of estrogen, postmenopausal women are at increased risk for a number of health conditions, such as osteoporosis and heart disease. To sum it up, menopause is not a single point in time, but a process, a life transition. It's not a disease that needs to be cured, but a natural phase of life for every woman. The timeline for this transition varies greatly among individuals. Some women may breeze through a quick and simple menopause, while for others it may be a more drawn-out process with more pronounced symptoms. Menopause is not an overnight shift, rather a gradual transition that takes time. It's a journey, and like all journeys, it's best navigated with understanding and patience. What are the primary signs and symptoms of menopause? This is a question many women find themselves asking as they enter the middle stages of life. Menopause, a natural part of aging, marks the end of a woman's reproductive years. But how does one identify if they're going through this transition? The truth is, the symptoms can vary greatly in intensity and duration from one woman to another. However, there are a few common indicators that can help you recognize the onset of menopause. One of the most common symptoms of menopause is hot flashes. These are sudden feelings of heat that can spread throughout the body, often accompanied by a flushed appearance and sweating. They can be as brief as a couple of minutes or last up to half an hour. Next, we have night sweats. Similar to hot flashes, night sweats are episodes of intense heat that can disrupt your sleep. They often lead to excessive sweating, making it difficult to get the good night's rest. Then there are the mood changes. Many women experience significant shifts in their mood during menopause. They might feel suddenly irritable, anxious, or depressed. These mood swings can be disconcerting, but it's important to remember they're a normal part of the menopausal transition. Finally, sleep problems are another common symptom of menopause. Difficulty falling asleep, staying asleep, or waking up too early are all signs that menopause could be at play. Some women also report feeling excessively tired during the day, which can be a direct result of these sleep disturbances. In conclusion, while menopause is a natural process, it can bring about significant changes in a woman's body and mood. Hot flashes, night sweats, mood changes, and sleep problems are just a few of the primary signs and symptoms of menopause. Recognizing these symptoms is the first step towards managing them effectively. By understanding what to expect, you can better prepare for this new phase in your life. Recognizing these symptoms is the first step towards managing them effectively. What are some of the less visible yet significant impacts of menopause, you might ask? Well, the journey through menopause is not solely a physical one. There's a less talked about side of menopause that's just as important: the psychological and emotional impacts. The hormonal fluctuations that occur during menopause can profoundly affect a woman's mental health. It's not uncommon for women to experience increased anxiety during this phase. Anxiety is more than just feeling stressed or worried. It's an ongoing sense of unease that can make it hard to carry out everyday activities. It can leave women feeling on edge, restless, or worried about things that may not seem significant to others. Depression, too, is a common companion of menopause. It's not just about feeling a bit low or sad, it's a persistent feeling of sadness that affects how you feel, think, and handle daily activities. Some women may find themselves feeling low-spirited, lacking motivation, or even struggling to find joy in things they once loved. Both anxiety and depression can make navigating menopause more challenging, but it's crucial to understand that these feelings are not weaknesses or something to be ashamed of. They're a part of the menopause journey for many women, and acknowledging them is the first step towards managing them effectively. The importance of mental health during menopause cannot be overstated. It's just as significant as the physical symptoms, if not more, because it affects how women perceive their transition and how they cope with it. The psychological impact can shape their menopause journey and influence their quality of life in profound ways. So let's lift the veil on the unseen impacts of menopause. Let's talk about them, understand them, and above all, let's address them. Because every woman deserves to navigate her menopause journey with dignity, understanding, and the right support. Physical symptoms are just one aspect of menopause. The psychological impact is equally significant. How can women manage these symptoms and maintain their quality of life during menopause, you may ask? Well, there are several strategies that can be implemented. Firstly, lifestyle changes can make a significant difference. Regular exercise is not only beneficial for overall health, but it can also help manage menopause symptoms by reducing hot flashes and improving mood. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can also help maintain a healthy weight and support to overall well-being. Sleep is another crucial factor. With the fluctuating hormone levels during menopause, many women experience insomnia or disrupted sleep. Incorporating relaxation techniques, such as meditation and yoga before bedtime, can help promote a good night's sleep. In addition to lifestyle changes, hormone therapy can be an effective method for managing severe menopause symptoms. This treatment involves taking medications that replace the hormones your body no longer produces after menopause. However, it's important to note that hormone therapy isn't suitable for everyone, and it does come with its own set of risks. Therefore, it's crucial to have a detailed discussion with your healthcare provider to understand if it's the right option for you. Alternative treatments, such as acupuncture, massage therapy, and herbal supplements can also be beneficial in alleviating menopause symptoms. However, it's important to consult with a healthcare professional before starting any alternative treatment to ensure it's safe and suitable for your specific needs. Finally, let's not forget the power of emotional support. Connecting with others who are going through the same experience can provide a sense of comfort and understanding. Joining support groups or online communities can provide a safe space to share experiences, seek advice, and gain reassurance. Remember, each woman's experience with menopause is unique. Some may breeze through it with minimal discomfort, while others may face more challenging symptoms. Therefore, it's essential to seek medical advice to help tailor a management plan that suits your individual needs. While menopause is a natural part of life, it doesn't have to be a distressing experience. With the right strategies, support, and medical advice, navigating this phase can be done with grace and resilience.